there, everyone. I'm Mary Widener,
And I'm Craig Coleman.
and we are here today to answer some common questions about assessment and treatment for children and adults who stutter. We collated these questions from students and clinicians, some common things you might see or deal with in stuttering treatment. So our first question is in regard to assessment. Is there ever an instance where someone doesn't qualify for therapy?
Well, I think you have to look at their overall assessment in terms of the impact of stuttering on them. And I would say that you might not qualify somebody for therapy if they are able to communicate in all situations without any negative reactions or without any negative social or educational impact on their life.
To follow up with that, what do you think about the wait and see strategy?
I'm not sure there is such a thing as a wait and see strategy. I would term it more as a watch and see, or just a monitor, because when you're looking at especially a young child who is showing some signs of stuttering, I don't think you just want to wait and not do anything. I think you want to be proactive about monitoring the risk factors that exist for a young child who stutters to make sure that they're not progressing into a more concerning stage that would indicate more long-term stuttering.
So when I think about watch and see, I'm really thinking about those preschool children. If a child is beyond the preschool years, I would never recommend a watch and see approach for that population where, the likelihood of stuttering recovery is going to be less. We got a lot of questions about children that are in therapy that might not be making as much progress or reaching the goals that are written in their report or in their IEP. How do we handle those situations?
I think a lot of the thing you have to look at there is why are they not reaching the goals, and I think that could be due to a number of different reasons. It could be lack of motivation, that the person doesn't necessarily want to be in therapy right now. It could be the fact that stuttering doesn't really have a negative impact on them, which means it might not be the best time for them to be in therapy right now. I also think that it could just be that the person might be tired of having a heavy focus in therapy of using strategies that can often be exhausting for a child to have to continuously monitor to use.
And I think one of the biggest things that I've learned in working with people who stutter is you have to give yourself, as the clinician, permission to shift gears, to change goals, to admit, hey, this approach isn't working for whatever reason. Let's work together to find out what that is. And sometimes that might involve actually going back to the goals and reworking those a little bit and doing what I like to call putting your expectations in line with reality in terms of providing the best supports and the most appropriate goals for your clients. How would you determine dismissal or if a child is discharged from therapy?
From a strategy perspective, I think that is all about, is the child able to use strategies, both speech modification and stuttering modification, when they want to use them. Not some arbitrary criteria of like 80% or 90%. To me, it's all about whether or not the kid can use them when they want to use them in the situations they want to use them in, knowing that maybe there might not be a lot of situations where they really want to use them. I think, again, we go back to looking at the impact of stuttering in those situations too, and making sure that at that point stuttering is not interfering with their ability to successfully communicate in social situations and in educational situations, or as people start to get older, in vocational situations. I also think you have to look at the knowledge aspect of stuttering and making sure that at that point in therapy, the person who stutters is the expert on stuttering so that they can answer questions about it, they know how to educate other people about it, and just making sure that, they're on a path to do whatever they want to do in life as a person who stutters.
So to follow up that question, we have a question here. What would your advice be for treating a stuttering client who's not experiencing negative reactions, not having negative emotions, not having difficulty socially, doesn't report any difficulty or changes in his life due to stuttering? What would you focus on in treatment?
Well, that's a really good question, and people ask that question a lot of times, and I think there's two different paths you can go with that answer. The first way is a person could come to you with that profile and say, I still feel like I really want to learn some strategies and techniques to use when I am in certain situations, and in that case, that's what you can focus on in therapy for a little while to teach them those strategies and techniques. And other times, people come to you and say that, and they don't really care about learning strategies and techniques right now. And I do think in those cases, it's probably not the best time to do therapy, because you're essentially forcing it on the person rather than it being something that might be productive for them.
Mm-hmm. What was the most intimidating aspect of your first therapy session with a person who stutters?
Is this the first therapy session for, like, that I ever did for somebody who stutters, or the first therapy session for each individual client?
Well, however you interpret it.
Okay. I think for me, I don't really want to use the word intimidated, because I don't think there's anything intimidating about it. I think the exciting part of all of those first sessions is that kids who stutter come to you as an open book. And, sometimes they're more of a closed book, actually, and you have to really work to unlock the doors to open a lot of what they have to say. And I think as you start to slowly do that, it's almost like the curtain being lifted, and you start to see somebody's real personality coming out, and that's really an exciting thing. So I guess I look at the beginning of stuttering therapy as more of an exciting thing rather than an intimidating thing.
When I first started working with people who stutter, it kind of fell into my lap, and I was pretty nervous to work with that population, to be quite honest, and resistant. And it wasn't really until I learned that stuttering therapy has this kind of ripple effect on a child's life as well as their family's life, their participation in activities, doing what they want to do, that I really realized the full scope and the importance of stuttering therapy. So when I made that connection of how deep stuttering therapy really goes and the importance of it, that's when I realized my role and responsibility as a clinician to not just change those surface level characteristics, but to really be an advocate for this person's life. And I think, to go along with Craig, that was a really exciting time for me as a clinician to make that realization and connection.